Okay, so we're going to discuss lower GI disorders starting in chapter 46 in your med-surg book. First disorder we're going to talk about is constipation, and constipation is something I'm sure we've all dealt with at some point in our lives. So basically what it is that the stool becomes very dry, compact, it's difficult to pass, it moves slower through the colon, and because of that, water is reabsorbed and just continues to make it harder and more difficult to pass. A lot of times it's caused by insufficient water, so we encourage our patients, if they're having constipation, we want to increase their fluids, encourage them to drink more. Sometimes it can be caused by ignoring the urge to defecate. If you're one of those people who will not poop in public, this could be you. Stress, drugs, inactivity. Of course, we always want to get our patients up, get them walking. Strictures, just narrowing. Chronic use of laxatives, in the nursing home, a lot of times our patients will want to be on a laxative every day. Well, this can actually cause them more problems than they realize, and it can cause constipation. So we need to educate them and let them know that they don't need a laxative every day. And then just having a low fiber diet, not a lot of fiber, not a lot of bulk to keep moving that feces on through the colon. Signs and symptoms would be an absent bowel sounds, bloating, abdominal distension, pain with attempts to defecate, not able to pass the stool is hard and dry, and even it can lead to rectal bleeding as well. They may pass a liquid stool right around the obstructing stool, and that's just showing that there is actually an impaction. They are able to release some stool, but it's not really getting passed. There is impaction. So you might have to actually check digital impaction and go in and fill that and dig it out for them, which if you haven't done that yet, I'm sure you will sometime in your nursing career. The treatment is going to be to treat the cause. So whatever it was caused by, if it was water, if it was inactivity, we want to get them up, we want to get them drinking, we want to get them moving, teaching them to try not to stress so much, inactivity, strictures, all those things, or just putting them on a higher fiber diet that can always treat the cause of it. An enema or a laxative, we can put them on a stool softener, and a stool softener is relatively safe to take every day, unlike the laxative, like I said. Dietary management, increasing bulk and fiber in the diet, and we may need to check for infections. So, teaching as far as nursing goes, we want to give them the high fiber. High fiber is going to draw that water into the hard stool. Raw fruits, dried prunes, dates, raisins, raw vegetables, whole grains, legumes, seeds, nuts, all of those things are an excellent source of fiber, so that can help greatly with constipation. Fluids, we want them drinking at least 8 glasses of water a day, and juices. Exercise is going to promote that intestinal motility. Laxatives, stool softeners discourage self-treatment with daily or frequent laxative uses. Stool softeners are fine. It's just going to kind of lubricate. And then when you gotta go, and you need to respond quickly to that urge and not hold it, even if you are in a public setting. Okay. Here is a cartoon. It's the worst case of constipation I've ever seen. Dynamite, blowing it up, right? Alright, so we also have the opposite of constipation, which would be diarrhea, and this is frequent passage of liquid or semi-liquid stool. And whenever you're looking at bowel movements, it can be anything from 3 stools a day is normal for some people, and then 3 stools a week is normal for some people. So it just depends, case by case scenario, what is normal for that person. So with diarrhea, they're having frequent passage of stools, greater than 3 a day. It's increased peristalsis, moving too quickly for the intestine to be able to absorb any of that extra water. So in the large intestine, that's where it's kind of reabsorbing water. Well, this one, it's moving too fast. It doesn't reabsorb any of it. It can be caused by a variety of different things: bacterial, viral infections, food intolerance, allergies, bowel disorders, metabolic disorders like Crohn's disease, and we'll talk about some of those later on. Major complications, dehydration, electrolyte imbalance, potassium can be lost, And anytime you lose potassium, what is a major complication that you could have with that? Okay, heart dysrhythmias, right? I know you said that, you got it. Alright, and you can also have vitamin deficiency. So these are the major complications that can occur with diarrhea: dehydration, electrolyte imbalances, vitamin deficiencies. Well, the treatment for mild diarrhea, it could just be as easy as changing your diet up a little bit and, avoiding a lot of the high fiber foods for that day. Resting the bowel with clear liquids. Of course, if you're having diarrhea, you don't want to continue eating anything and everything. You want to kind of rest that bowel. Chronic diarrhea, you can do anti-diarrhea medication, IV fluid and electrolytes to reintroduce those electrolytes into your body. TPN, if it's really, really severe, we could do TPN. Antibiotics or antivirals as needed to treat it, especially if it is caused by the bacterial or viral. And then probiotics to just replenish that healthy flora. You know that there is flora in your gut, normal flora all over your gut. Well, sometimes we have to reintroduce that with probiotics. For nursing, if it's mild, it's eliminating foods that cause diarrhea. Maybe it's the spicy foods, over-seasoned food. Giving them clear liquids, 1 or 2 meals until the diarrhea subsides, and then slowly introducing back a very bland diet to them. With chronic, we don't want to over-medicate them, and we don't want to overuse Lomotil, Imodium, kaopectorate. All of those things can definitely help, but again, you can get on the side where you over-medicate them as well. Lactobacillus bacillus is restoring that good bacteria, that good flora to the gut. Of course, whenever we're looking at documenting, we ask as nurses the great questions. We want to know all about your poop. We want to know what it looks like, the consistency of it, the volume, the number of stools you're having. Sometimes we'll even ask you about the smell. And if you've ever smelled C. diff, you know why you ask about the smell. So, yes, we ask all those good questions. We get real nosy about your poop. And then we also like to talk about it as we're, having lunch or dinner or whatever. It drives the spouses crazy, I'm sure. But, yeah, that's a nurse's life, right? Okay, so we're going to assess the peri area for excoriation, just making sure that skin all around the anus is not broken down or anything like that. And if it is, of course, we'll treat that. Monitoring for fever, abdomen pain, it may indicate perforation. If it perforates, if the bowel perforates, we know that that's very serious and will cause a huge infection. And so we got to get them to surgery immediately. So we're watching for that. Monitoring white blood cell count, H&H, making sure they're not actually bleeding out. And it's okay. He's using the urinal, but it's okay. He's got diarrhea. It's liquid, right? It goes right through. Okay, C. diff. This is actually something that surprisingly isn't in your book, but it's very common and you will see it in the hospital and you need to know about it. So make sure you study up on it. It is part of the normal intestinal flora, but it can overproduce. And if it overproduces, it can cause some serious problems. So it can invade with extensive antibiotic therapy. A lot of times what you see is they were on an antibiotic and then they come back in, they have chronic diarrhea, and it's ends up being C. diff. It can be very resistant to certain antibiotics, and so therefore it can be very difficult to treat. It releases toxins that causes spongy diarrhea. It'll cause fever and abdomen pain. We're going to treat it with vancomycin, a very strong antibiotic, and or flagyl, metronidazole. Make sure you know that name though. That's the one they'll use on the NCLEX. We do put them in contact isolation because these spores, this disease, C. diff, will shed spores, and these spores can live on surfaces for a very, very long time. And the problem with C. diff is if you're carrying your paper or your clipbook in there and you set it down on a table and then you pick that up, you've just got spores on your clipboard. You go to your next room, you set it down on that table, and you've just exposed your other patient to C. diff. So you have to clean with soap and water, hand sanitizer, and those alcohol gels do not work with it. So make sure you're cleaning with soap and water, and gowning and gloving as well. Okay, so irritable bowel syndrome. Of course, it's not a disease, it is a cluster of symptoms, and that is why it's called IBS, irritable bowel syndrome. It is a motility problem that affects the colon. It's more common in women, but is also possible in men. Symptoms increase with stress, menstruation. Okay, so the menstruation part doesn't really go with the man, but food intolerance, abuse, psychological dysfunction. It will cause cramping, flatulence, diarrhea, constipation. Should be no sign of blood since there isn't really an actual disease. Again, just symptoms. We're going to treat it with diet changes, adjust fluids, fiber intake, and eliminating irritating foods. Depends on if diarrhea or the constipation are more frequent, what kind of treatment you're going to do. So sometimes if it's constipation, you're going to add that fiber food. If it goes back and you start having diarrhea, of course you're going to take that down and you're not going to be eating those fiber foods. You're going to do the bland liquid diet. So ruling out actual disorders and disease, we're going to do some radiography, endoscopy, and a colonoscopy to just make sure that it isn't more of a disease like Crohn's disease, and it is just some symptoms that they are having due to these things right here. Okay, so going a little bit deeper, the ANS affects GI function. So did you know that your brain actually controls your bowel movements? And the reason behind it is it stimulates the inhibition of the neurotransmitters affecting the intestinal mobility. So acetylcholine is released, parasympathetic neurotransmitter, motility increases, and you result is diarrhea. Sympathetic neurotransmitters respond, then you have constipation. So there you go. With inflammatory bowel disorder, now we're talking about disorders, there are two different types. You have Crohn's disease, but then you also have ulcerative colitis. So don't get confused with IBS and IBD. We'll go into more detail next slide or next presentation with Crohn's and ulcerative colitis. But we're going to stop right here.